Hi, this is Andrew Garcia, and I'm doing my IM injection medication administration checkoff for BMS Summer 2020. I have my IM worksheet, and I have the BMS paper chart to refer as my MAR. So I'm gonna begin. The first step is to verify the healthcare provider's orders. So I'm gonna go onto the MAR. I see Anna Pawlowski. I'm gonna verify her allergy, which is penicillin, reaction to hives. So she's not allergic to the medication. Medication is influenza vaccine. I see it here on the MAR. Verify the order for 0.5 milliliters IM. And now I'm going to introduce myself. Hi, my name is Andrew. I'm your student nurse for today, and I'm here to give you your influenza vaccine. Can I have your name and date of birth, please? Anna Pawlowski, XXXX. And I see here Anna Pawlowski. Well, I checked the wristband, Anna Pawlowski, XXXX, and then on the computer, Anna Pawlowski, 551957. Do you have any allergies I should know about, Mrs. Pawlowski? Penicillin. I see her wristband. And the computer says penicillin, reaction to hives. And now I'm going to do my 6 rights for medication administration. So, right patient, Anna Pawlowski. Right drug, influenza vaccine. Right dose, 0.5 milliliters. Right route, intramuscular, right time at 14:58. And right documentation. I have the 6 rights verified. Now I'm gonna educate the patient on the medication. So Mrs. Pawlowski, I'm here to give you your influenza vaccine because it is an active immunization against the pandemic H1N1 virus with inactivated virus. Do you have any questions for me? No? Okay. Once I've educated the patient, I'm gonna assure safety. So I'm gonna make sure the bed's in the lowest position. I'm gonna check the brakes. Make sure the side rails are up and her call light's in reach. Now that safety is assured, I'm going to close the privacy screen and close the door. Now I'm going to sanitize my hands. I'm going to check if I need any calculations. I see here on the MAR at 0.5 milliliters, the dosage. I see there are no calculations needed or required. And I'm gonna use proper body mechanics and maintain patient privacy. So I'm just gonna sit him up using the button. So patient is now sitting up. And now I'm gonna identify the 3 injection sites for IM. I'm going to begin with the deltoid. So with the deltoid, you're going to start at the acromion process, and you're going to put 2 to 3 fingers below that. And then you're going to draw an imaginary triangle, and that is the injection site area for the deltoid. It can hold up to 1 milliliter of medication. The next site is going to be the ventrogluteal, and for the patient, I would put my right hand on the left side and my left hand on the right side of the patient. But for this, I'm just going to show you that I'll put the heel of my hand on the greater trochanter bone, and I'm gonna place my index finger along over the anterior superior iliac spine and extend the middle fingers towards the buttocks, creating a V shape. And in the middle of that V shape right here is the injection site for the ventrogluteal. And the last site would be the vastus lateralis. So again, I would start with the heel of my hand on the greater trochanter facing down on the side. And just so you can see, usually I have my leg straight, but I would place one hand above the knee as well. And on the outer midline portion of the thigh, that area between those 2 spaces is the area for the injection site at the vastus lateralis. So now that I've identified those 3 sites, I will gather appropriate equipment. So I'm gonna start with the syringe. I have a 22 gauge by 1 inch 3 milliliter syringe, and I have gloves. I have my influenza vaccine, my vial, alcohol pad, and gauze, and a pen. So I'm going to start by, I would take everything, and I would also need my EMR and my sharps bin. I'm just gonna verbalize my sharps bin later when I dispose of the needle, but I don't have one here. So the next thing to do, I'll collect my material, go to the patient's room, bring my EMR to the patient. So I'm in the patient's room now. I'm just gonna sanitize my hands. And I will verify the 6 rights again before I prepare the medication. So Anna Pawlowski, right patient, drug, influenza vaccine, dose, 0.5 milliliters, intramuscular at 14:58, and have the right documentation. So they're both good. And now I've done that, I'm gonna sanitize again. And I'm just going to, so you can see, I'm going to remove the cap. I'm going to time, date, and initial. And I'm gonna use a clean alcohol pad, brand new one, to clean the rubber stopper. After I've done that, so I'm going to withdraw 0.5 milliliters of air, and I will place it in the middle of the rubber stopper, and I will ensure it's not touching the solution, and I will inject air into air. And now I'm just going to invert the vial, and I'm going to draw up 0.5 milliliters of the medication. I'm doing this at eye level. And I'm just gonna safely recap. And I would label my syringe, put a label with the patient's name, Anna Pawlowski, influenza vaccine, 0.5 milliliters, 14:58, and the date is 6/1/20, and then I'm going to initial AG. So I've labeled the syringe, and now I'm just going to do my third check. So compared to the MAR, right, patient Anna Pawlowski, influenza vaccine, 0.5 milliliters, IM at 14:58, and I have the right documentation. So I've done my last check, and I'm at the bedside. So now I'm just gonna sanitize my hands. Now I'm just gonna don gloves. Once I've donned the gloves, I'm going to select the correct administration site. So I'm going to use the deltoid. So I'm going to have him relax it and put it on the side of his body. And now I'm going to, I would use a clean new alcohol pad, and I would clean the area in a circular motion. So I'm gonna again use the anterior, or the chromium process. Use 2 fingers in that area there. I'm gonna allow it to dry. So I'm gonna uncap. I'm gonna hold it like a dart. And I'm gonna Z-track it. So I'm gonna pull the skin, pull the skin away from the site, about 1 inch away. And I'm gonna go 90 degrees, inject. So I injected it slowly, hold for 5 seconds, and release. And I'm going to use the gauze, and I'm gonna engage the safety and dispose in the sharps bin. So the needle goes in the sharps container. And I would place a band-aid here, if I had one, until the bleeding stops. And I'm gonna dispose of all medical equipment into the trash. And I'm gonna remove my gloves. And throw it in the trash. And now I'm just going to document my that I gave the medication at the deltoid, 0.5 milliliters of influenza vaccine. And I'm going to do any assessments after my administration. And afterwards, I'm just going to assure safety. So bed is in the lowest position. Side rails are up. Call lights in reach. And I'm gonna check the brakes. So the bed brakes are on. And now I'm just gonna ask if she's comfortable. Miss Wawowski, are you comfortable? Do you need anything? No? Okay, now I'm just gonna open the door and open the privacy curtain. I'm just going to sanitize, foam out. And that concludes my IM checkoff. Thank you.